Welcome, guest. How are you?
We're doing well. Good to see you.
Good evening. Good to see you.
Thank you for being here. Raheem, I do have to start with you because the chat is loving you. I want to give you big ups from the Joy Reid Show chat are all big fans of yours. So talk to me about how you got involved in this Gilead Sciences initiative. And what is it?
I've been working with Gilead since last year. I had the opportunity to do a collaboration where I take my artistry and use it to educate, doing what I do on stage and touring. And we had the opportunity to build with over 40,000 women, not to mention all the men and that were there for date night, and to get the information out about the latest statistics and HIV and the latest, medication that's available, PrEP, which has been around for 10 years. And it's been great to do what I call it. I think of it as Joy as like a party with a purpose.
Yeah.
Edutainment is like what I like to call it.
Yeah, absolutely. Because listen, date night is very important. So we want to make sure the date night is a safe night as well. Dr. Roger Mitchell Jr., talk to me about where we stand in terms of HIV, the rates of HIV. They seem to be going up in some places. Talk to me about where we stand.
Well, first, I want to thanks for being on the National Medical Association. I'm the 126th president. We're actually in Chicago, Joy, at our 123rd convention. We're here with Gilead Science, with Raheem Devon, and dedicated to really making sure that our membership, Black physicians from all over the country, have access to this great information surrounding PrEP and making sure that it's part of their primary care regimen that they're providing to our community. Quite frankly, making sure that they have. Now, I'm gonna refer your question to Dr. Noirfor.
Yeah.
She is the expert in epidemiology of this disease process. But I will say that our over 3,000 members that represent over 50,000 Black physicians are working closely with Gilead and closely with Raheem Devon to get out the message that we need to make sure that our patients are getting tested, that they know their status, that our patients know that this is a disease that is can be undetectable, and that we need to have access to medication, particularly in the era of the act that is happening now that's trying to roll back our access to Medicare.
Yeah, absolutely. Dr. Noirfor, please answer that question. Is HIV infection rate going down? Are we seeing the prevalence go down? And how has PrEP changed things?
The landscape. Thank you so much for that. And, like I said, I work with Gilead Sciences as an executive director, really with a company that's been committed for over 3 decades to really innovative treatments in and looking at breakthroughs for HIV, for hepatitis, and for cancer. And while we have made great progress over the last couple of decades with HIV, what we are still seeing in the United States is that in 2023, there were still 39,000 new HIV diagnoses that year. And so what that means is that while we've made great progress over the last couple of decades, we are still seeing almost 40,000 new diagnoses every year. And there are differences by region, by race, by ethnicity, where certain populations remain consistently disproportionately impacted by HIV. The impact of PrEP, which has been around, HIV pre-exposure prophylaxis, initially since 2012, so 13 years this summer, and then more recently, another medication for PrEP approved last month, is that in places where there has been a big uptake of PrEP, there has been a decline in HIV incidence in those areas. So we know that PrEP works to prevent HIV acquisition. We know that treatment works as prevention if we can test people, link them to care, and get them virally suppressed, where they live healthy, productive, long lives, quality lives, and they also have an undetectable viral load, which means they can no longer transmit HIV sexually to their partners, something we call U equals U, undetectable is equals untransmittable. So we have the tools to end the epidemic through treatment as prevention and with prevention as treatment. So we have the tools to end the epidemic. We have made great progress. I've been in this field now for almost 3 decades. However, the progress is not uniform, it's not equal, and we still have a lot of work to do with communities of color, with women, and just to make sure we can truly end the epidemic in the U.S.
Absolutely. And Dr. Mitchell, let me ask you this, because it does feel like there is a bit of a war on science going on in our country right now. Is it becoming more difficult, especially if Medicaid is threatened, for people to be able to get treatment and get access to PrEP and get affordable care if, in fact, they do find that they are HIV positive?
Yeah, it's a big risk, Joy. I mean, there is a war on medicine and science. We know that we have individuals that are making decisions, and it's not based on the literature. It's not based on science and medicine. It's based on something else. And that something else can be structural and institutional racism. That's something else can be dollars and cents, but it's not being based on true medicine and science. And it puts us all at risk. Those that are carrying a chronic disease like HIV. HIV is one of these disease processes that if you have access to testing, you have access to a clinician, you have access to the medication. It's a disease process that you can live your whole life with and live a good life with. But it's also one of those diseases is if you don't have access, it could kill you. And it is indeed still those that don't have access, still claiming the lives of those that don't have access to those areas.
And Raheem, you're lending your fame to this, which is, so good of you to do, because for so long, there was such a stigma around HIV/AIDS that people wouldn't admit, that they had it. I recall Freddie Mercury dying, and people at first didn't even know why he died, because it was very clear that there was such a stigma that, a celebrity passing away, you didn't know why, because people were so afraid to come forward. How has that changed to the point where you, as a celebrity yourself, can join this project? And how is that making it easier? Is it making it easier to get people to come forward and to seek treatment?
Ironically, I'm the new voice of and radio personality of the original Quiet Storm on 96.3 WHUR in DC. And we just celebrated the late, great Melvin Lindsay's birthday, who transitioned from complications of HIV and AIDS. And absolutely. I think that it's no time like the present for us as artists to aspire to inspire, to use our gift. I think this is one of the reasons that the gift is bestowed upon us, to bless the world, but also to navigate and be able to use that to talk about community issues. I'm no stranger to the community, doing community work with my Love Life Foundation since 2012, ranging from HIV to domestic violence to mental health as well. So, anything that I can do to lend a hand, lend my voice, it's not always just about entertaining. It's about going out to the communities and, and touching the people. A lot of times entertainers come to our city and get the bag and keep it moving, so to hang behind, come in a day early, meet with the mayors, meet with city officials, faith leaders, and to create this collaboration in the fight against HIV has been a major priority of mine since 2012.
Yeah, and it's interesting because I do remember even when Eazy-E died from HIV. I mean, there's been so much stigma when Magic Johnson, who's still living quite healthy, and when he first announced that he had HIV/AIDS, you could go on. Let me ask you, Dr. Nwafor, what has changed since then? Since the Arthur Ashe days, since the Eazy-E days, how is it that we no longer directly associate HIV/AIDS with dying?
Absolutely. Thank you for that question. What has changed is the commitment and the resilience of the communities impacted and also the innovation, right, to create new medications to help people live and suppress their virus, and the dedication to not just viral suppression, but to the quality of life of people living with HIV. Also the innovation in prevention so that people have options when it comes to how they protect themselves from HIV in terms of oral medications or injectable medications, and that continuing development and drug discovery. So that has changed. What has not changed is the fact that there's still a lot of stigma, as you mentioned, around having conversations around HIV. And that stigma impacts people's ability to want to get tested, ability to stay engaged in care, to retain in care, to get their partners tested because of that stigma. So as we look at initiatives and innovations to develop and discover new treatments and prevention modalities, it's important to also think about things that allow us to have conversations like this to address the stigma, because until we end stigma, we really cannot truly end HIV. They're really intricately tied together. So incredible innovation, the resilience, the people who have participated in clinical trials to get us to where we are, the partnerships with the community, with healthcare providers, with public-private partnerships, all of those things are key, very important, but innovation without really, really looking at it from a lens of equity and making sure that innovation does not worsen existing disparities. So, with convenings like this, where we have, partnerships and we have healthcare providers and community icons and leaders really talking about the same thing, about how do we end the epidemic and how do we do this together. So a lot has changed, a lot of work to be done still.
Indeed. I'm going to give you the last word, Raheem. Where do our viewers find more information so that they can be informed?
On the healthysexuals with the S.com. Once again, that's healthysexuals with the S.com. Get the information, learn about PrEP and preventative medications. And, again, I'm so honored to do the work. Thank you, Joy, for having us on the show. And thank you for all that you're doing in the community and globally as well.
Thank you so much. I want to thank Dr. Toyin Nwafor, Dr. Roger Mitchell Jr., and of course, the great Raheem Devon. Thank you very much. We're looking forward to new music from you too, my brother. Thank you all very much. We appreciate you. Thank you so much. All right, you guys, we're trying to give you some information, make sure that you are fully empowered and informed, and as well as ready to fight.